This is Dr. Robert Troell at Beauty by Design. When women come for augmentation of the breast, they're often questioning, do I need a breast lift or not? So initially when they come in, classically if they're in their 20s and 30s, if they haven't had children, rarely do they need a mastopexy or a breast lift. So in those situations, if they want their breasts enlarged, their two options are one, a breast implant or fat transfer. So we do liposuction, purify and enrich fat, and place it in the breast. That's one alternative. And some people do both. They don't like the shape of their breasts and the implants are round. We do a breast implant followed by a staged breast fat transfer or fat grafting procedure. When someone presents themselves, we observe them. If they have a mild amount of breastosis or drooping, then we can just do an implant. If it's large enough, it gives them an adequate lift. If not, and they need a minor lift, sometimes we just need a incision either at the superior part of the breast, called a crescent lift, where we just remove a little bit of the skin and elevate the areola, or we do a circumareola incision and just do a minor breast lift. So if someone needs a breast lift to get where they need to go, there's a variety of options for that. Most plastic surgeons do a inverted T, which is a horizontal incision, vertical, and they use the skin to support the breast. I do not do that technique. Why? A vertical mammopexy gives you a better lift because you're using pillars of tissue instead of just your skin to support the breast. It lasts longer because of the same reasoning that extra pillars of tissue are better support. Plus, you don't have that horizontal incision. 70% of women that have been surveyed do not like a horizontal incision. Technically, it's harder to learn how to do a vertical lift. It's harder on patients that have a larger breast, but it can be done with learned techniques, and I've been adequately trained and practice vertical lifts throughout my entire career. So a vertical mammopexy is needed to lift the breast in certain patients. Patients who want their breast larger and lifted, we do a combined augmentation mammopexy. It's combining both of those together. We do the breast lift, we put a temporary or template in when we're doing the lift to make sure we have the adequate position of the end nipple areolar complex. We don't want it too high, we don't want it to be too low. Sometimes when you do those procedures, especially in people that are very, very thin, a body mass index below 18 or 19, or have very, very thin tissue, in those people, we sometimes need a scaffold. It's an extra piece of tissue. We either use acellular dermal matrix, which is from an animal, either a human, a pig, or a cow, or we use a synthetic absorbable monofilament, which is what I prefer because you don't have the risk of getting a seroma as much compared to using an animal-based product. You don't need to use a drain in the majority of cases, and it has much better support than you do the other type of scaffold. So occasionally we need to use a scaffold to keep the implant in place at the proper position, or to provide extra coverage of the implant. So we determine that during the consultation. Do you just need an augmentation, either with an implant or fat grafting, or a mastopexy or a breast lift by itself? If you want your breast larger, we combine the two and do an augmentation mastopexy.